People who suffer strokes often don't recognize that the signs they're experiencing during a stroke signify brain damage, so they don't get to treatment in time for the best possible outcome. This is such a tragedy because although there has been effective medication available to treat most strokes for many years, a stroke patient must begin to receive this medication very quickly after the stroke signs begin. Because people don't recognize the signs of a stroke, they too often wait too long. They may die or live with a lifetime of disability simply because they didn't recognize the emergency, which is a stroke. There are 3 objectives for this training session. The first is that by the end of it, you will know the signs of a stroke. The second objective is by the end of this training, you will be confident in the immediate need to call 911 as soon as you suspect a stroke. And the third and final objective is that you will be inspired to teach this information to someone else. Many emergencies, like we see on this slide, are clear and obvious, prompting us to immediately act. No reasonable person would see that choking man giving us that universal choking sign and say to him that he should probably make an appointment to see his doctor later on this day or the next day. No reasonable person would suggest that or even think that. It's clear that he's having an obvious emergency and needs help now. Likewise, no reasonable person would turn the corner in the office and see that businessman lying there on the floor with the phone in his hand and think maybe he should just be allowed to sleep it off. It's clear, it's dramatic, it's obvious that he's experiencing an emergency and needs help now. In these 3 situations, the emergencies are clear, dramatic, and obvious. But with strokes, there can be very different situations. Strokes are not always clear. They're not always dramatic. They're not always obvious. Many times the signs can be very subtle, which leads people to suggest that the person displaying the signs take a nap or call their doctor for an appointment later that afternoon or the next day. Strokes are not always clear and dramatic, which is why so many people sometimes don't get to treatment in time. You're going to see in this next slide a video of your first of 3 strokes. This next video is of a woman named Julie Chen, who's in her 40s. She is a newscaster out of Tulsa, Oklahoma, doing a live broadcast. During the broadcast, she begins to have speech difficulties. She begins to have trouble reading the words from the teleprompter and processing them to read them and speak them out loud. She's suffering a stroke. That's the only stroke sign we can see. It's subtle. It's not dramatic. It's not obvious. She's smiling. She's in no obvious distress. But Julie Chen's stroke signs are every bit as serious and potentially deadly as what you see on the screen right now. But a reasonable coworker would quite understandably tell Julie to just go home and get a good night's sleep, because her stroke, like many people's strokes, are not always clear, dramatic emergencies, but Julie needs medical intervention right now. All right, here's the first of your 3 strokes. This is Julie Chen.
The Tulsa Air and Space Museum is hosting a launch today at the event. The event features live. I'm sorry, something is going on with me this morning, and I apologize to everybody.
Strokes are common. 1 in 6 of us will suffer a stroke in our lifetime. Anyone of any age can suffer a stroke. We saw that Julie was in her 40s. Even people younger than Julie can and do suffer strokes, although our odds of suffering a stroke do increase as we age. Strokes are the #1 cause of disability and a leading cause of death. They're so common that every 40 seconds someone in the U.S. suffers a stroke, and every 4 minutes someone dies of a stroke. People often end up living with a lifetime of disability or dying simply because they have a stroke that is not clear, obvious, and dramatic, as we saw Julie's signs. They don't know that those signs suggest a serious condition that warrants immediate medical attention. It's important to understand what a stroke is. At its most fundamental, a stroke is blood flow interruption to the brain. Our brains are super sugar-hungry, oxygen-hungry organs. They are constantly bathed in a supply of blood. When one of the blood vessels feeding that brain tissue becomes blocked, which is a common cause of a stroke, as we see in this image, and the blood flow stops, the brain tissue that was receiving nourishment from that blood immediately begins to die. The patient immediately begins to suffer brain damage. So for whatever reason, when blood flow interruption occurs, brain damage begins, a stroke is occurring. Normally, blood flows freely through our blood vessels, carrying with it the oxygen, sugar, and nutrients we need to feel and behave normally. You can actually feel this happening in your own body. If you take 2 fingers and put them just on one side of your neck, you can feel your pulse right there in that blood vessel on the side of your neck. That blood vessel is ferrying blood up to your brain. And this is what that blood vessel should look like. Ideally, it should be nice and wide and open with those blood cells able to flow freely. And that's your blood being carried up to your brain to nourish the brain tissue. One of the more common causes of a stroke is from an obstruction in that blood vessel, as we see in this image. The brain tissue that was receiving nourishment from the blood beyond that blockage immediately starts to die as soon as the blood flow is interrupted. So this is one of the common causes of a stroke, and this is what's happening inside. The blood flow is being blocked. It's being interrupted. So as we said, strokes are often not immediately recognized because the signs can be very subtle. They're not always clear and dramatic and obvious. Another reason strokes are sometimes missed has to do with the way our brains are formed, because stroke signs can be different depending on where the blood flow in the brain occurs. So for example, if the blood flow interruption happens at the base of the brain, the stroke patient might experience sudden onset balance or dizziness problems. And this actually happened to New Mexico Senator Ray Lujan on January 26, 2022. The senator was suddenly, inexplicably unable to walk across the room without falling over. He was just so dizzy. He had such a balance issue, sudden unexplained balance problems. And the senator did what many well-meaning, well-educated people would do in such a situation. He just took a nap, hoping that that stroke sign would go away. He didn't realize that sudden onset balance problems suggest a stroke. If the blood flow interruption happens in the back of the brain, the stroke patient might experience sudden onset vision changes. Sudden onset vision changes can range from anything between sudden onset blindness in one or both eyes, sudden onset double vision or blurry vision. My vision has been getting worse for the past 5 years. That's not a stroke. The stroke sign would be a sudden onset blurry vision. All of the sudden vision is blurry. One stroke patient had the stroke sign of all of a sudden he could see out of both eyes like normal, but all of a sudden everything in his field of vision turned this rust color. That was his stroke sign. Another stroke patient was telling me that although she could see out of both eyes, all of a sudden she could only see half of everything she was looking at. That was her stroke sign. So sudden onset vision changes suggest a stroke. And I hope that it's obvious why many well-educated, well-meaning people would quite reasonably make an appointment with their eye doctor when they experience any of these kinds of signs, but not after this class. After this class, you know that sudden onset vision changes suggest a stroke. If the blood flow interruption happens in the part of our brain that helps us produce speech, we might start experiencing sudden onset speech difficulties, anything from slurred speech to the inability to find our words to maybe just speaking gibberish. If the blood flow interruption happens in the part of our brain that helps us understand speech, although everyone around us is speaking normally, we might suddenly hear them speaking gibberish because we're unable to understand speech based on where the blood flow interruption is occurring. So lots of different signs can suggest a stroke, all based on where in the brain the blood flow interruption is occurring. About 60 to 70% of patients, depending on the study, who are experiencing stroke will display one-sided facial drooping or body weakness. So on this slide, we see 3 patients who've been asked to smile, and you can see that only one side of their face is able to to execute that command. Only one side of their mouth is able to rise, and only one eye, the eye above that side of the mouth, is able to crinkle up in response to the rising side of their mouth. They're only able to smile on one side of their face. The other side is somewhat droopy. This is a common stroke sign, but it's not a conclusive stroke sign. So going back to the very first stroke video that you saw in this presentation of Julie Chen, if you remember, Julie Chen was able to smile beautifully with both sides of her face. So although one-sided facial drooping and body weakness is a common stroke sign, being able to smile fully doesn't rule out a stroke. You can still be having a stroke even if you don't have this particular sign. In this image, we see a common field test, a common test doctors or paramedics will perform in the field when a stroke is suspected. The patient is asked to perhaps sit down, close their eyes, and then hold both arms out in front of them, as we see in image A. Oftentimes with a stroke, we'll see one arm start to droop down. Sometimes both arms droop down or fall down, as we see in image B with a one-sided body weakness. So that's a common stroke sign, that one-sided body weakness with that arm drooping down, but not all stroke patients will display this one-sided body weakness. And it's important too to remember that not all the time even patients realize this is happening to them. So sometimes patients will insist with their eyes closed that both arms are being held up equally, but the patient will actually look like the image of B here with the woman's one arm drooping. They're not even aware sometimes that one arm is drooping. They're not even aware because remember, the patient is suffering brain damage. So about 60-70% of patients will have that one-sided facial drooping or body weakness, but we want to get you closer to 90 to 95% of stroke signs that patients exhibit. So on this very busy slide, which will get easier momentarily, we see that about 90 to maybe 95% of patients, stroke patients, will exhibit at least one, and you only need one of the stroke signs on this slide. The stroke signs are sudden and unexplained. So the loss of balance or dizziness, it's a sudden onset balance or dizziness. It's not that someone just got off a roller coaster, for example. That would make sense that they're dizzy, but it's a sudden onset, unexplained loss of balance or dizziness, or the sudden onset vision changes. Now, or the facial drooping, sudden onset facial drooping, the body weakness on one or both sides. Many of us have, for example, taken a nap and you're sleeping on your arm and you wake up from your nap and your arm is all tingly because you've been cutting off the blood flow to it. There's a reason why that happened. You know why. You were sleeping on it funny. As the seconds tick by, the arm is getting better. So that wouldn't be a sign suggesting a stroke. The stroke signs are sudden and unexplained. And then the difficulty understanding or forming words. The other tricky part with this is stroke signs can start and stop. So we only need one of these stroke signs to suggest a stroke, even if they stop. We still need to get treatment immediately. We still need to see a medical professional immediately. We need to get to the emergency room right away if even one of these stroke signs presents itself. So an easier way to remember these stroke signs is with the acronym Be Fast. In the setting of a stroke, if you suspect a stroke, we want you to think of Be Fast. Is the patient experiencing any balance issues, any sudden onset, unexplained balance problems? Is the person experiencing any problems with their eyes? The E is for eyes, sudden onset, unexplained vision problems. Double vision, blindness, blurriness, color changes, sudden onset problems with their eyes. Is the patient experiencing that one-sided facial drooping? The F is for the face. The A is for arms, one-sided or both arm weakness, sudden onset body weakness with the arms especially. The S is for speech, sudden onset unexplained speech problems, anything from difficulty producing speech to understanding speech. Any one of these signs, and we only need one, are enough to suggest a stroke, and that leads us to the T. The T is for time. If someone has any one of these stroke signs or more, you can have more, but at least one, the T is for time to call 911. This next video is of your second stroke that you will see during this training. This is a video of a woman named Stacy who suffered several strokes over several days. The first time her stroke happened, she knew something was wrong, but she didn't take this class. She did not know what you now know. She did not know those B-fast stroke signs. She started experiencing some of the B-fast stroke signs, and she made the mistake, and we'll talk about why it's a mistake, of driving herself to her doctor's office. By the time she arrived at her doctor's office, the stroke signs had stopped. Stacy explains her signs to her doctor. Her doctor tells her that he thinks she's just suffering from stress and she needs to breathe deeply and do a better job managing her stress. So Stacy leaves the doctor's office somewhat discouraged, naturally. She's in her car when the stroke signs come back. She whips out her phone. She videos herself having a stroke, still not knowing what's going on because, again, she didn't take this class. She didn't know the B-fast stroke signs. She's experiencing her stroke. She's trying to manage her stress, not having any idea what's wrong with her. She drives to another healthcare provider who recognizes the signs, and she finally gets treatment. So this is a video of Stacy's stroke.
My name is Stacy Jeppes, and I suffered 3 strokes from March 31st for 3 days in a row up till April 2nd.
It's all tingly on the left side. On the left side, the doctor said to breathe in, breathe out, manage your stress, and I'm trying. I don't know why this is happening to me. It happened this morning again, so now I'm taking a picture for an example of what happens. My tongue feels very numb. I just tried to take a drink of something, and I couldn't drink it very well.
It's important to walk away from this training realizing that if you've seen one stroke, you've really just seen one stroke. Going back to the B-fast stroke signs, you only need one of those stroke signs, but some patients will have multiple stroke signs. With Stacy, we saw that she had slurred speech and she had one-sided facial drooping. Even patients who experience multiple strokes over their lives can have a different presentation for each stroke event. So for one stroke, they might have 1 or 2 of the stroke signs. For their next stroke, 6 months, 6 years later, they might have 1 or 2 or 3 completely different stroke signs. Every stroke can be different, which also explains why strokes can sometimes be difficult to recognize, because you only need one of the B-fast stroke signs and every stroke can present very differently. All right, that leads us to your third and final stroke of this presentation. This is a stroke recorded by Dr. Ron Paul, Congressman Dr. Ron Paul, who suffered a stroke during a live interview. This video does loop through twice. See if you can recognize any of Dr. Ron Paul's stroke signs from the B-FAST acronym.
Liquidated. We have to get rid of that. That's a burden. We can barely just we can't buy it. Liquidated. We have to get rid of that. That's a burden. We can barely just we can't buy it.
Okay, so the congressman displayed 2 different stroke signs. Unlike Julie Chen, who was struggling to find words, and unlike Stacy, who was slurring her speech, the congressman's stroke signs, one of them at least, was it also involved speech, and his speech devolved into just gibberish. He wasn't even able to slur his words to where they were understandable as Stacy was. He couldn't speak any discernible words. If you noticed as well, the congressman suffered a very obvious left-sided facial drooping. So those were the congressman's stroke signs. And I hope by now we've accomplished the first of our 3 objectives, which the first objective is for you to know the stroke signs. Those are B-fast stroke signs. Now we're going to move to the second of our 3 objectives. The second objective is for you to be confident in the immediate need to call 911 as soon as you suspect a stroke. And the reason for wanting you to call 911 immediately is really because, in a very, very meaningful sense, during a stroke, time is brain. We know that every minute during a stroke, 2 million brain cells die. Now, we have a lot of brain cells, but 2 million is a significant number. Remember, as soon as that blood vessel becomes blocked, as soon as the blood flow interruption begins, brain tissue begins to die. The patient experiencing a stroke is suffering brain damage that is continuing. It's continuing. And we need to do everything we can to stop that blood flow interruption and to restore that blood flow. And we know that the patients who have the best chance of recovery are the ones who get to the emergency room right away as soon as the stroke signs begin. We want you to get to the emergency room by calling 911. In 1996, the FDA approved a medication to treat strokes. The catch with that medication is because it's so powerful that after just a few hours after the stroke signs begin, the risks of administering that medication outweigh the rewards. So for you to even be eligible to receive that medication, you need to get to the emergency room right away after the stroke signs begin. The safest, best way to get to the most appropriate facility is by calling 911. Even though the medication has been available for nearly 30 years, we still see that the vast majority of stroke patients arrive at the emergency room too late. They arrive outside that time window to even be eligible for the medication. Despite nearly 30 years of the medication being available, we're not seeing that number improve. Too many people arrive at the emergency room too late, and we're not seeing an improvement on that number, even though it's been nearly 30 years, largely because people still do not recognize those BFAST stroke signs for the medical emergency that they are. We want you to call 911 as soon as the stroke begins. We never want a stroke patient to drive themselves to the emergency room. Remember, the stroke patient is suffering brain damage. Too many times in my career as a paramedic, I have been called to the scene of a car crash where the driver is unconscious and unresponsive. I can't even assess a driver who's unconscious and unresponsive for a stroke. I can't do that field test on them. I can't ask them if they're experiencing any of the BFAST stroke signs. I can't see if they are because they're unconscious and unresponsive. They're a danger to themselves when they're driving with the stroke signs, and they're a danger to everyone else on the roads and on the sidewalks. It is dangerous to get behind the wheel because the patient is suffering brain damage if they're having a stroke. So we never want a stroke patient to drive themselves to the emergency room. In a similar manner, we never want the stroke patients to have a friend, family member, coworker drive them to the emergency room. And the reason for this is because not all emergency rooms can treat strokes with this medication. Remember, the medication is powerful. The doctors and nurses who administer it have to go through special training. The hospital, the emergency room needs special certification. So if a well-meaning coworker, friend, relative drives the patient to the emergency room who might be suffering a stroke, and that emergency room is not one that is allowed to treat strokes in this manner, that emergency room will send the patient to the next closest facility. But remember, we're up against a time wall here. So the transfer from one emergency room to another just eats away at that time window. You need to get to the emergency room right away. You need to get to the right emergency room right away. And if someone drives you to an emergency room that doesn't treat strokes, your time window is just dissolving. We want you to call 911 because EMS professionals will also save you time. Many times when I'm with a stroke patient in their home, in the driveway before they've even left their home, I'm on the radio with the emergency room staff telling them that I have a stroke patient coming in. As soon as the emergency room staff hears that EMS is bringing in a stroke patient, the emergency room staff activates the hospital's internal stroke team, which means the emergency room staff is calling doctors and nurses from all around the hospital who are trained to treat strokes. Those healthcare professionals are waiting for you and I to arrive at the emergency room, so we're ready to treat you. They are ready to treat you as soon as we arrive. They're clearing out that machine that you see there. They're clearing out the CT scanner, so it's ready for you, the stroke patient, to go into as soon as you arrive. Another reason to call 911, not only because we can save you time by alerting the hospital before you even get there, will save you time, but sometimes those machines break down or they're under maintenance. When that happens, dispatch will tell the EMS professionals on the streets not to bring a patient to that hospital because their machine is under repair, under maintenance. So we'll take you to the next closest facility. So we know which hospitals are open and available to treat strokes, and we're going to take you to the closest appropriate facility in a timely manner and save you time. Time is brain. EMS is the best way to get you to the closest, most appropriate facility in a safe manner. Many times when I give this talk live, people will ask questions during the Q&A session about money. Clearly, money is an issue for many of us, and there is often a cost associated with EMS transport, especially if insurance is not involved. So this is one slide, and it's indicative of many studies just to show that the cost of missing the stroke, the lifetime cost of the stroke is orders of magnitude higher than that of an ambulance cost. And this study doesn't even include the cost of lost wages, that sort of thing from the stroke itself, lost productivity to society. So the point of this slide is to say, yes, sometimes an ambulance does incur a cost, but if the stroke is untreated, if the stroke is treated outside the window, the cost can be so much higher. Your best chance of a full recovery from a stroke is getting to the emergency room right away as soon as the stroke begins, and calling 911 is the best, safest way to get you to the closest appropriate facility. So I hope by now we've accomplished the second of our 3 goals. The first was for you to know the BFAST stroke signs. The second is for you to be convinced of the immediate need to call 911 when you suspect a stroke. And we'll move on to the third objective, which is for you to be inspired to teach this information forward. This is a pie chart indicating the results of one study, which is indicative of many studies that show us that only about a third of stroke patients get to the emergency room via 911. The other 2/3 arrive at the emergency room via their family or friends, coworkers will drive them. And we talked about all the reasons why doing so can cost time. So only about a third of stroke patients get to the emergency room via 911, and only about 4% of that third are the stroke patients themselves who called 911. So what that means is if you who are listening to this recording are the one who is suffering a stroke, statistically, you are very unlikely to be the person calling 911 for yourself. You're very unlikely to be able to help yourself. It's other people who recognize the signs or who are able and do call 911 for you. Just like no one in the entire history of our planet who has taken CPR has ever performed chest compressions on themselves when they're dead from a cardiac arrest, it is unlikely that you will ever be able to call 911 for yourself if you are suffering a stroke. We don't take CPR for ourselves. In general, we take it for other people. We can't perform chest compressions on ourselves when we're dead. In many cases, we don't call 911 for ourselves when we're suffering a stroke. It's others who do that. So for you to be safe from a stroke, for you to have the best protection, if a stroke does strike you, it's important for you to have a 2 or 3 minute stroke smart conversation with those around you. Talk to your family, your friends, your coworkers. Make sure they know the BFAST stroke signs so that if you start to exhibit those stroke signs, they'll recognize those stroke signs for the medical emergency that they are, and they will call 911. We know that knowledge has a shelf life. We know that if you were to take a quiz at the end of this presentation, you would know all the BFAST stroke signs. But knowledge has a shelf life. It fades over time. 6 months from now, you might not remember one or more of the BFAST stroke signs. 6 years from now, you might remember even less. So to help you remember, the Virginia Department of Health is making memory aids available for free. These are magnets and wallet cards that list the stroke signs. They're available, even shipping and quantity is free. And we encourage you to get them, to put them somewhere where you will see them regularly. The hope is that if you see these magnets and wallet cards on a regular basis, that if you come across someone who is suffering a stroke, your mind will be reminded that, hey, that's a stroke sign. I need to call 911, and you'll be confident in doing so immediately. These are wonderful memory aids. We encourage you to get them, and not only to keep them for your friends and family, but to go even further than that and be a stroke champion. Help change the terrible dynamic that for nearly 30 years, too many people don't recognize the signs of a stroke because they didn't take this class. They don't know the simple BFAST stroke signs. Take the Virginia Department of Health funded memory aids and wallet cards and spread them around. If you belong to any kind of faith-based organization, see if you can talk to the leaders there and get this information to those congregations. If you belong to any civics clubs or social clubs, talk to the leaders and see if you can present this video to that group. The slides are also available for free, so you can take these slides and scroll through them at your leisure and give this talk on your own in a live setting. The video is free as well. The QR code there will get you to a website where you can fill out a form and contact someone to get you whatever information you need. We can order the magnets and wallet cards directly for you, or if you go to that website, there's a link there on the Virginia Department of Health for Stroke Smart supplies. You can order them yourself if you prefer. There's also links to PDF files. If you just want one or two, you can download the PDF and print them yourselves. Take this information and spread it. Help us change the awful dynamic of people suffering a lifetime of disability simply because they started to experience the stroke signs, not recognizing them for what they are, taking a nap, or calling their doctor for an appointment the next day. All terrible mistakes in the setting of a stroke that impede the ability for a full recovery. It's important to recognize the BFAST stroke signs and call 911 as soon as you suspect a stroke for the patient to have the best chance of a full recovery. You now have life-saving knowledge that you can easily transmit to others in 2 or 3 minutes. Hand them a magnet and a wallet card. Change this dynamic. Save lives, reduce disability from stroke through this simple conversation. There's tools here for you to get help. We're happy to help you. We're waiting to help you. Please take this information out there. Please save lives, reduce disability by making others stroke smart. Thank you for your time.